In men, the most common cause of sexual dysfunction is erectile dysfunction, affecting around 8% of men aged 20 to 30, and 37% of men aged 70 to 75. Although not a life-threatening condition, erectile dysfunction significantly impairs the quality of life and work productivity. Just as an example, studies have shown that erectile dysfunction nearly doubles the risk of depression and anxiety in affected males, warranting the importance of appropriate treatment. Thankfully, medicines like sildenafil can treat erectile dysfunction effectively. Sildenafil, sold under the brand name Viagra, acts by inhibiting the effects of a key enzyme called phosphodiesterase 5 in the penis. This enzyme is mainly detectable in the smooth muscle of the corpus cavernosum, and a key factor in inhibiting penile erection. The question is, how does this enzyme inhibit penile erection and avoid prolonged erection? First off, let's see how normal erection happens. Corpus cavernosum is a tube of spongy-like tissue being located within the penis. Normally, the penis contains two corpora cavernosa. Besides, a third spongy chamber, so-called corpus spongiosum, is located beneath the corpora cavernosa and surrounds the urethra. Spongy tissues are mainly composed of smooth muscles, and therefore sensitive to vasoactive chemicals like nitric oxide. Penile erection happens when these three masses fill up with blood and become engorged. During sexual arousal, local nerves, blood vessels, and lining of cavernosal sinusoids begin to release nitric oxide, a potent muscle relaxant in the penis, triggering the smooth muscles to relax. This results in dilation of blood vessels, corpora cavernosa and corpus spongiosum, allowing the penis to fill with blood and become stiff. PDE5 disrupts penile erection by neutralizing the relaxant effect of nitric oxide on smooth muscles. Medicines like Viagra can enhance and prolong erection, simply by blocking this enzyme and enhancing the effects of nitric oxide. To maximize its efficacy and get the best results, take the followings into consideration. Just like other medicines, Viagra is not a miracle. Without arousal and sexual stimulation, it does not produce any result. Besides, Viagra may not work the first time you take it. So don't give up easily. Try it at least 2 to 3 times to see if it works for you or not. If using Viagra for the first time, 50 mg on empty stomach 1 hour before having sex can be effective enough. Its effects last for up to 4 hours. So don't take it in the morning if you plan to enjoy sex in the evening. Administration with large or high-fat meal can delay absorption and therefore reduce its efficacy. If any side effects appear, reduce to 25 mg once daily. Besides, if you are over the age of 65, start with the dose of 25 mg instead of 50. Just in case of unsatisfactory erectile response, the drug dosage can be increased up to 100 mg per day. Not surprisingly, sildenafil has some unwanted effects. Headache, flushing, dyspepsia and visual side effects such as vision color changes, blurred vision and photophobia are the most common ones. Additionally, it can cause certain serious side effects we will talk about in future videos. By the way, if you have experienced any side effects with sildenafil, please let us know down below in the comments. Hope to be healthy and enjoy using sildenafil.